Me, my, mo, mum. You don't remember that lady that made us do that? She was like a vocal coach.
Remember
Come
all
on.
that?
Oh yeah, the neck rolls and into the chest. Felt a bit silly. Have you done those again since we went to that conference? Those vocal warm ups?
Yeah, some of them. We do a couple before we start every podcast.
But what about like if you're preparing for a public talk or a lecture, or any speaking engagement, you don't do it?
I think we did when we did lectures for MPH classes in the back room.
You think so?
I think so.
What if Dr. Thin saw us?
No.
He wouldn't have let us live that down.
What the hell are you two boys doing?
All right. Hey, everyone. It's Gordon and LaShawn back with another episode of the Public Health Insight Podcast. And it's only fitting that we follow up that discussion on vocal exercises, preparing to give MPH talks and all that with precisely the reason why we're here in this podcast, to continue sharing the lessons that we learned since graduating from our MPH program, which builds on a lecture series that we developed for the class of 2024 MPH program at Western University, who we were graciously invited by Dr. Amardeep Thin to come in for the third year running, something like that.
Yeah, sounds about right.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. It was very positively received, and we thought, why not distill it down to a podcast where we can explore each of those lessons learned in a more deeper and connected way for you who are listening here. So do you want to give a quick recap on what the other ones were before we dive into 6?
Sure. So if you are up to date, you won't need any reiteration on this, but the first one was making the most of your MPH, especially while you're still in it. Number 2 was getting your first job is a big step. Number 3 is how do you stand out at your workplace? Number 4 was learning and professional development doesn't stop. And number 5 is the importance of knowing your worth. If any of those topics resonate with you and you haven't had a chance to listen yet, go check out our podcast episodes. And they're pretty recent, so you could find them pretty easily. So check it out.
Yeah, and if there are lessons you learned from completing your MPH that we're not capturing effectively on our list, feel free to share them with us. There's a link in our episode description that tells you how you can reach out to us. So looking forward to hearing what you have to say. Now back to this current world that we live in. Building your dream career. Lesson number 6. So shout out to, first of all, shout out to Sujani from the PH Spot, who we had on our podcast. Sujani is a good friend of ours, and we were graciously allowed the pleasure of having her on our podcast. I want to say 1 to 2 years ago. I can't remember now. And she came to us to talk about how she was sharing her journey in building her dream career. So that inspired conversations that LaShawn and I have had with each other, as well as with others in our network, as well as with the broader PHI community who reach out to us, who we're able to sit down and have one-on-one meetings with. And we want to use this as an opportunity to explore this concept. So the first place I want to bring us to is, I feel like in high school, LaShawn, I don't know what your parents were telling you. My mom was saying, get a job, get a job, get a job. And then I feel like when you go through academic training, so post-secondary, it shifts from getting a job to go get a career.
Okay.
I feel like, so that in terms of the rhetoric that I was being fed by
Mm-hmm.
my family. So what's the distinction between get a job and then get a career?
Yeah, I mean, it seems to me that a job can be encompassed within a career. A
Okay.
job to me is more like thinking about things in isolation, like a single job, a specific
Mm,
job title, whether you work at McDonald's, Tim Hortons,
mm,
or you're a research analyst
mm,
at an organization. They're very single instances. But when you start thinking about a more holistic perspective and viewing all these experiences, your roles, your education, and the pathways that you take to achieve your ultimate goal of being in a profession like a public health professional or maybe a doctor,
mm,
uh, it's more wide encompassing. And sometimes being one of those things alone does not dictate a career.
mm.
It's everything leading into it that's a career. So you could be one of these things and also gain fulfillment out of doing a side hustle, like opening up your own business or starting your business or volunteering. So it's all of those things put together to achieve your overall goals in your professional career.
Okay. Now, let's explore it like this for a second, right? So I feel like the distinction between a job and a career can only come from the person who's in that situation. Like, I can't tell you, LaShawn, that what you're doing now is more of a job than a career. Only you can
Yeah.
tell me based on what the alignment is with your overall goals. Does that make sense?
Yeah.
Right? So if
Yeah.
someone is at Tim Hortons, perhaps they see themselves in that organization long term, potentially staying in the same role or moving up, and then they
Yeah.
might see that as more of a job. Sorry, as see it more of a career than a
Yeah.
job. But then if their goal is to use that to satisfy their basic needs until such time they can maybe go back to school or do something else, then in that case, that person might see that more of a job than a career that they eventually will go towards.
Yeah, that makes
Does that
sense
make
to me.
sense?
Yeah, it does. Uh, and to further clarify, like I know you alluded to Sajani at the beginning. Uh, she has kind of thought about and reflected on a couple of points that she thinks about when she's navigating her career, and it
Mm.
almost acts as a sort of compass when you think about how an individual can navigate their career. And Sajani mentions these four things. So, my core values, my needs, strengths I possess, and my interests. So,
Mm.
taking all those into account, realizing that you're not just going to be interested in one thing oftentimes. There's also things that get your attention that, still contribute to your overall career and your interests. So, there are multiple things to consider, like in Sujani's model. And
Mm.
yeah.
So that also brings up the question which we wanted to explore next around, can you have a career without it being necessarily your dream one? And I think what you maybe were getting at there helps us to answer that question.
Yeah, yeah. How to navigate it, right?
Yeah.
Yeah. And I think where this is all coming from is, you're very passionate after you graduate from your public health degree, for example, and you have a lot of goals and ambitions. And then when you start working in the real world and getting your first job, maybe your second job, you realize, there's not, you can't do as much as you potentially thought.
Mm.
Like you wish your organization maybe did things a different way. And those are things that where you can't really control as much as you would have liked.
Mm.
And so people might start thinking about, like only if I could do this or if I could do that. And maybe that's an opportunity for them to volunteer somewhere else or start their own side hustle or do other things that help fill those voids that they see in just a single job that they would have had.
Mm. You know what example comes up a lot from as we meet more people who have a different kind of background and training in sort of the health and social space is I've been interacting a lot more with social workers. What you just described comes out a lot in those conversations. So what I mean by that is I know a lot of social workers who are clinicians and provide counseling who had that appetite to pursue leadership and management positions, which then takes them away from sort of the day-to-day interaction with clients and patients.
Yeah.
And while they do appreciate the administrative skills that comes with being in leadership and being able to influence people and be involved in more higher level decision making, they never really lose that want or itch for clinical counseling and things like
Yeah.
that. That's something that I'm finding in my conversations with social workers. They never
Mm.
really tend to really lose that, and they
Yeah.
miss it quite a lot. And therefore, as much as they see themselves in leadership positions, some of them, they still maintain other opportunities where they can exercise that passion and interest by maybe having a their own personal practice, professional
Yeah.
practice where they can
Yeah.
see clients, or doing a few hours at an organization part-time that allows them to do that. So in real time, you could see folks in this type of position building out their dream career, in that I don't get fulfillment completely from this one aspect of what I do for my work, and how do I seek it out elsewhere to feel like a more completed and rounded person professionally, right?
Yeah. Yeah, that makes a lot of sense to me. I think that's a great example. And oftentimes it's the opposite too, right? Maybe you're just into public health and you're finding yourself at the organization you're working with that sure you're having a lot of population level impact, but are you actually on the ground talking to people face to face? And oftentimes the longer you work at an organization at that level where you're working at the population level, you don't have any interaction, there's something lost there, right? And oftentimes people can find volunteer opportunities and work for a local organization, maybe help out at their local food bank or volunteer at their local health organization to kind of get them more person-to-person interaction that they're missing out on in their regular 9 to 5, for example. So yeah, that was a very good example, and I think it could go both ways for sure. But it's just demonstrating the point that this notion of just getting all your fulfillment career-wise out of one particular role might be a bit outdated.
So I wanted to get more personal now. So in terms of what that looked like for each of us, what did building out your dream career look like, LaShawn? Because I know where we started prior to meeting, right? And then having met in our MPH program, we had an idea of how things might want to play out, and then there was a reality of things. So how has that kind of shaped up for you in the present moment, in terms of some of the things that you did along the way to build out what would have been your dream career? And I'll share mine after you too.
Yeah, no, it's a great, thoughtful question. I think for me, when you think about graduating from your MPH, everyone really has these really high ambitions of, wanting to do better in the world. That's why we kind of get into public health. We want to make a difference. We want to change things. So when, for example, I started, I worked at a global health organization, and I thought I was doing a lot of great work there, to be honest, and making a lot of connections. The work was impactful, working across multiple countries around the world to combat different diseases and disease groups. So there's a lot of impact there. But I think for me, you kind of notice things that you wish you could change or do differently because you, based on your experiences and your knowledge and your expertise, you think that could lead to better health outcomes. And inevitably what you see is at any organization when you're doing this work, there's a lot of barriers, organizational barriers in place, whether it's funding agents, whether it's government policies or organizational policies that really get into your way of doing effective public health practice. And sometimes, obviously, you got to respect that because oftentimes a lot of these rules are in place to protect workers and the populations you serve. So there's good reasons behind many of these policies. However, knowing this and knowing what I knew, I wanted to find a different avenue to express myself and some of the passions that I had in public health. And one of those Gordon and I united on was creating a side hustle, Public Health Insight, which y'all are listening to this podcast right now. It was one of the brainchilds of those initial ideas. where we wanted to make public health information more accessible, understandable, and used by all. And so I didn't think I could really do that at the scale I wanted to and the way that we wanted to at the organization I was at. And learning some of those limitations for me was eye-opening because it made me realize exactly what we're talking about on this podcast. One role or title won't necessarily give you the full fulfillment that you want.
I'm glad you said that, because I was about to chime in and say, why not just then leave the role that you were at to find a role that would give you all of that? But I think you're saying in reality, you understand that you won't find everything that you need in one role.
Yeah. And in any role that you're in, you're going to find things you like and things you don't like. And that doesn't mean you keep switching around jobs necessarily to find the one where you're loving everything. Maybe that means just adding a different piece to that puzzle. We're not saying add a second job. Where it could be a bunch of different things, like spending more time outdoors, volunteering, advocating for a cause you're passionate about. So there's a lot of different things that you can do in your community or online these days that can potentially add those other components that are missing. What about you, Gordon?
I'm glad you brought up PHI too, because I think that's where things intersected for us. So yeah, for me, I was initially interested in infectious diseases, had a pivot to chronic diseases, understanding my positionality as a non-clinician, and I was comfortable with that and okay with that. And then I realized, so as much as we do what we do because we love it and things like that, there's still financial goals that you want to realize. So I also understood that the best chance of realizing my financial goals in the sector that we're in was also to look at leadership type positions and exploring ways to get there. What I did realize that after eventually this becoming a reality of moving from, I think you use the term often, LaShawn, individual level contributor up to management, is that you evolve the skills that you need, and then you gain interests that you maybe didn't think of, but you also lose things that you were previously interested in, and you miss out on those things. So I used to love writing things from scratch, doing knowledge translation, doing pieces around that, and I was more sort of disconnected from that work, in that your primary goal is to supervise people in realizing the goals and the missions of themselves personally, as well as the organization. So PHI gave me a way to exercise that creative outlet without necessarily compromising my new position, realizing that there's no win-win. You just kind of have to stack until you get to a point that you're comfortable with. So that worked out really well, and PHI was a great vehicle to explore things that you would never dream of about exploring in an actual formal employment position. And it's good in that sense because you kind of compartmentalize risk as well, and you also are able to learn things in one that you're able to then bring to the other, which is very rewarding. So you kind of stack things together until you get to a point where, obviously I remember having a conversation with a previous director, and he was talking about, you're interested in being a director one day. I'm like, nah, let's just chill right now. I'm happy. I think I want to stay at this level and build out the other aspects of my life to then see where things fall and if that's something I want to pursue in the future. And that's what we mean by building or stacking up your arsenal so that you can have a well-rounded career that you feel fulfilled by, and one that makes you feel happy that you're able to exercise your passions. So that's kind of how things evolve for me. And I'm in a sweet spot now where I'm happy. And instead of looking at my actual career, I'm looking at the things around it to see how it can fit together at this point. So that's kind of where I'm at.
No, I really like that. And that was a great example that you shared. So I know people now are probably wondering, how do you actually build a dream career that matches your uniqueness? What would you say to that, Gordon? What advice would you give people? Don't follow my career. Because if you don't follow my career, you won't find your career.
No,
Something
because
like
if you
that.
do follow my career, then you won't. It's shout out to Dr. Strong.
Dr. Strong, we butchered it, but
We
it
butchered
was a
it.
sick quote.
It was a great quote. Basically, he
We'll
was
insert
saying,
it here. We'll insert it here.
yeah,
He's gonna do that.
you're funny. It's easily findable because I think it was a soundbite. But
Yeah.
the message there was around. I think it was in response to someone saying they admire him and they want to be like him one day, and he had sort of the humility to say, "If you be like me, then you won't be like you, and we
Yeah.
need you to be like you."
A young individual came up to me and said, "What do I need to do to have your career?" And my response was, "If you have my career, you've made a terrible mistake." Right? Yeah. And that's what she said too. But it's not what I meant. If you have my career, then you didn't have yours.
And so I think that's kind of where Dr. Strong was coming from. But it was a very compelling quote in the way that he kind of said it. But my advice would be just to be in tune with yourself. So obviously, when you talk about things like, I like to use a pie chart example, and I was kind of alluding to it in my previous remarks about your pie. There's a circle. You can divide that circle only so much, right, into your pie. And you have the size of the things in your circle should correspond to what you feel like is the most important. So that's in flux all the time. So in order to maintain that circle and the circle doesn't explode, you have to be in tune with what your goals are. You have to be in tune to how things might change for you over time too, because you might maybe what you thought you were interested in at the time is now no longer the reality, because when you did do it, it didn't make you feel good, or maybe you weren't interested in it. So constantly reevaluating these things, asking yourself the skills that you want to learn, right? So what skills do you want to learn? Data, stats, epi, public speaking, blah, blah, blah. Looking for opportunities, whether it's your primary job or otherwise, to fill that. Looking for ways that you want to contribute, things that make you feel good, been able to contribute to that. Asking yourself if having a legacy is important to you. Sometimes, and then what does that mean? Usually if you have a legacy, you have to kind of be in a certain niche and contribute to that niche over time to inspire people, motivate people in that niche until it grows and grows. And then over time, you would have left a legacy if you conduct yourself with class and dignity and contribute to that area of expertise. Like, is that something that's important for you? So niche down. If you're looking for more around the earning side and you want to have more freedom to explore the things around other parts of your life, maybe you're looking for jobs that pay very well, but maybe it doesn't require too much out of you beyond the immediate work that you're doing. And so building out that type of career might look differently, right? So it's all about looking at where you're at and how you can add those different pieces around it.
Yeah. No, I really think that's some good advice. I would just also encourage people to reflect on, the current situation, the roles that they're in currently, and think about, is there anything that's missing or wish you could have done or can do that would, something that you're passionate about, your actual interests, based on some of your strengths, based on some of your needs, like Gordon mentioned, financially, potentially, and your core values, I think, is important, right, in public health. And what I just listed off there is exactly what Sujani suggested in terms of a compass to navigate your career. So all of those things that we talked about today on this episode come back together full circle, overarching on all those 4 components.
And you know what? We did have a question that we were going to end the podcast with, but I'm going to flip it a bit. I'm going to put it out there to the public health insight ethos, the public health insight community. And it's around the concept of, does a dream career, or the concept of it, is it something that evolves over time? So if you made a plan for yourself 5 years ago, should you be following that to the T? Should it be rigid? Is it something that you have to hold yourself accountable to? If it changes, does that mean that you failed? Like, we want to hear your thoughts on that. We have our own thoughts, which we could have delved into, but we're not. We want to hear what you think just around that, because I think traditionally if you had a goal and you didn't accomplish it, it would be considered as a failure. But I think now there's a little bit more acceptance that things can evolve depending on the season, your interests at the time, or external factors. So we want to hear where people's heads are around that whole piece around, is it okay to change what your dream career looks like? So on that note, Gordon and LaShawn, leaving you with that to digest. Until next time, peace.
Peace. Take care.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.